So question 34. We have a 10-year-old child that being followed up for dilated cardiomyopathy. When you're talking about dilated cardiomyopathy, you know that in the long run, patients will develop heart failure. And you would discover that in this patient, there are already signs of edema reading through the question. So they are asking us, by what mechanism does systemic edema or edema develop in this particular patient? That is, when the heart cannot pump blood effectively, definitely more blood is going to be put in the veins, and those veins are veins of the greater circulation or systemic circulation. So directly, that is venous congestion of greater circulation. I just asked us a very easy question. After objective clinical examination, a 12-year-old child was diagnosed with mitral valve prolapse. This is an organic defect. It's an anatomical defect. And how do you confirm that? You majorly do echocardiography to observe, to look at the valve. Echocardiography. All right. What localization of intracranial hemorrhage will cause a patient to have vomiting, nystagmus, and all these already like sign of increase in intracranial pressure that must be happening at the level of the subarachnoid. So this is a patient with subarachnoid hemorrhage. Already this hemorrhage, a question of intracranial hemorrhage, but where? See, vomiting, nystagmus, spasm, and so on. It's only in subarachnoid hemorrhage. 15-year-old boy was attacked twice by bees. Notice this question is not about treatment. This question is about prophylaxis. So we have been attacked by a bee, and as a result of that, develop anaphylactic shock. What is the most effective prophylaxis method? And when a patient is having a known allergy, so what you do is to desensitize the patient to that particular allergic, to that particular allergen, and that is exactly this option: desensibilization by means of bee venom extract. A 9-year-old boy has been suffering from bronchial ectasis. We've talked about this question several times, I think in surgery or internal medicine. We've said that further treatment of for a patient with bronchial ectasis is surgical treatment. So it's going to be a lobectomy, that particular lobe, not the whole lungs, so that lobe of the lung. So surgical treatment always for further treatment of bronchial ectasis. A child with tetralogy of Fallot is most likely to exhibit what? Tetralogy of Fallot, I'm sure now we are trying to remember the 4 major things that are present in tetralogy of Fallot, and one of them is right ventricular hypertrophy. And right ventricular hypertrophy is usually as a result of increase in the right ventricular pressure. So the 4 major conditions in tetralogy of Fallot is, I termed it POVR for easy members. That's pulmonary valvular stenosis, overriding of the aorta, ventricular septal defects, and right ventricular hypertrophy, which is dependent on the 3 previous factors. So the correct answer is increased pressure in the right ventricle. So when they are telling us about a patient that is bleeding on vaccination at such a very, very young age, they are thinking of hemophilia, because they told us that there is considerable rise in consumption of prothrombin and single prolongation of the activated partial thromboplastin time. There are factors that cause this increase in activated partial thromboplastin, and one of them is hemophilia. 10-year-old boy with hemophilia has signs of acute respiratory viral infection with fever. All of the medication, antifebrile medication, are contraindicated to this patient. When a patient is having viral infection, one major thing that you are careful of is not to give aspirin. Not that you can't give aspirin, but you are just being careful because it's one of the few drugs that can cause Stevens-Johnson syndrome in a patient, if the patient could develop such reaction. But there must be an underlying viral infection. Viral infection plus aspirin can cause Stevens-Johnson syndrome. So aspirin is acetylsalicylic acid. Later, we'll differentiate Stevens-Johnson syndrome from one of the options that we are going to come across. 7-year-old child is sick for 2 weeks with runny nose, was taking nasal drops. The boy suffers with alimentary allergy. That applied to doctor, this is suppurative and blood discharge from the nose. So already that has ruled out adenovirus, rhinitis, and any other virus. Suppurative, you think of bacteria. So maceration of anal nausea and upper lip. So there's whitish gray areas of nasal septum. That sounds like something that diphtheria would do. It's like diphtheria leaving its trademark behind. Mucous membrane of oropharynx is not. What's in this is diphtheria of nose. This is happening mostly at the level of the nose, and the option is simply telling us, please pick me. 10-year-old boy underwent treatment in cardiology department for rheumatism. What drug should be given for prevention of rheumatism recurrence? Majorly, this kind of patient can give penicillins, and by their trade name here, is it penicillin, penicillin 1 or 5? Please, let's just keep that back of our mind. Penicillin 5, Bisilinum 5, Bisilinum 5. If you check for Bisilinum 1, you will not even see any information, probably only in Ukrainian language. So the correct answer is Bisilinum 5. A friend was trying to find a way to remember this, and it was saying 1 plus 2. I forgot how I did, but it's also interesting. Anyways, Bisilinum 5. A child is 4 years old, has been ill for 5 days. Anyways, this is still a condition of a patient of a child that is having measles. We have just rephrased the word coryza to means puffy face and so on. So this is cough, conjunctivitis, and coryza, the 3 C's. So you can read further. You know that we should also bear back in mind that measles could also sometimes cause pneumonia. And so that's why this patient is having other associated signs as dry racing lungs. So it's measles. A 10-month-old boy has been ill for 5 days after consumption of unboiled milk. When you are talking about unboiled milk, undercooked egg, or whatsoever, you are thinking of salmonellosis, coupled with the fact that the stool is dark green with admissions of mucus. So if they are not telling us about blood in the feces, blood defect, we know that's shigellosis. If they are also telling us that there is segment colon tenderness, that's shigellosis or dysentery. So we don't have any of those 2 factors here. This makes salmonellosis still very, very accurate. Again, what condition will make a patient to have permanent moist cough together with recurrent pneumonias? What condition? I'm thinking of a condition that is always causing fluid. Bacteria love fluid because it's a medium for food and other things to grow for them, and that's why there are recurrent infections in condition of mucoviscidiosis, cystic fibrosis. You have a lot of mucus being produced to give them a very good environment. I'm just saying that in case they will not tell us about the sweat chloride test in the question, but however we have it here. Anytime they tell you about sweat chloride, they don't tell you for fun is cystic fibrosis, but they are telling us here, so it makes it much more easier. Mucoviscidiosis or cystic fibrosis. Please note, in the exam they might not be putting back, they might just put cystic fibrosis, they might put mucoviscidiosis without cystic fibrosis and so on. Okay, this is a child that is hypertensive. Acute glomerulonephritis presented with hypertensive syndrome during the first day. They are simply asking us, what is the role of angiotensin II in the pathogenesis of hypertension? So let's just quickly revise the RAS, renin-angiotensin aldosterone system. You have low blood pressure, the kidney senses it, and due to decrease in blood flow to the kidneys release renin. There's increase in renin release. Renin enters into the blood. Go to look for angiotensinogen that is produced by the liver. Angiotensinogen welcomes the brother renin, converts itself to angiotensin 1. Angiotensin 1 so that I don't belong here anymore, enters into the blood, goes into the lungs. When it gets into the lungs, it's looking for an enzyme. Angiotensin converting enzyme finds it, converts it into angiotensin 2 in the lungs. Angiotensin 2 enters into the blood. It can directly cause increased vasoconstriction itself, or go to the level of the adrenal gland to cause increase in aldosterone release. Aldosterone is going to therefore increase blood pressure, cause probably hypertensive syndrome, by increasing sodium and water reabsorption. So blood pressure is increased on the basis of volume. That's that about that. A full-time infant is 3 days old. You know, when they tell us all this history, skin is epidermis is peeling, and the infant has scarlet skin syndrome, and so on. What is the most probable diagnosis? Please always watch out for this question, this particular symptom. If they tell that Nikolsky symptom or sign is positive, it's usually positive in about 3 major conditions. It's positive in Staphylococcus scarlet skin syndrome, which is what we have here. Is SSSS. So it's positive there. It's also positive in pemphigus vulgaris. It's positive in pemphigus vulgaris, and is positive in toxic epidermal necrolysis. Toxic epidermal necrolysis. So just we can keep those 3 conditions at the back of our mind. So in this particular case of scarlet skin syndrome, the staphylococcal organism releases exotoxins that can cause exfoliation of the skin. So it's more like, if you know that another name of this scarlet skin syndrome is also exfoliative dermatitis, you already know the answer. So the correct answer here is exfoliative dermatitis. Exfoliative dermatitis. I think we also come across another question that will help us to talk about this Nikolsky symptom the more. District pediatrician, the question is, what prophylaxis should a doctor recommend in a 1-month-old child? The first thing you want to prevent is rickets, and yeah, that's what they mean by this rachitis, rickets. All right. Urinary parameters given, we have hypoproteinemia. Okay, this is still in the blood, sorry. Hypercholesterolemia. So we have proteinuria. There's proteinuria but no hematuria. So that rules out nephritic syndrome. It rules it out. So this is simply a condition of nephrotic syndrome. If you don't find blood, go for nephrotic syndrome. All right. So when you can see temperature rise of 38, rhinitis, dry superficial cough. When we are talking about superficial cough, we are majorly, and it is dry, you are talking of the very upper airways. You say palpation didn't reveal anything over the lungs. Percussion sounds as a wooden resonance. Auscultation reveal no rails. You know, that's why you do not have such changes, because it's in the uppermost part of the lung. So you can take note of this dry superficial cough, flabbiness, and appetite loss, for it to be simple tracheitis, acute simple tracheitis. You see, bronchitis and other things, they are going to show diffuse processes in the lungs, but this dry superficial cough is typical for tracheitis. 5-year-old girl with transitory immunodeficiency has right-sided pneumonia during 3 months or during 2 months. Why is it delaying? Why are you having pneumonia for 2 months? Why is it delaying? So how pneumonia progress can be described as delaying. Okay, mother of 10-month-old baby reports significant pallor. So poor appetite and large abdomen. As neonate, the child underwent treatments and so on. There's jaundice and anemia. Skin is pale and jaundice teeth are absent. Abdomen and last skin is palpable. You can see hemoglobin, red blood cell, color index 0.9. What type of anemia has occurred in this patient? So we can see that our color index is normal. It's normal. So this is a condition of hemolytic anemia. And how can we say for sure that it's hemolytic anemia? Because it's not iron deficiency. And this is just looking like iron deficiency. If it's iron deficiency, color index should be low. But here they said as a neonate, the child underwent treatment in Ipe for jaundice and anemia. So whatever is happening in this 10-month baby, it's not just happening right now. So that's hemolytic anemia. And hemolytic anemia will show spleen to be palpable. Please take note of these things. Palpable, hemolytic anemia. Alright, 12-year-old girl took 2 pills of aspirin. What's aspirin doing in this question? So they want us to think with it. You can see the temperature 39 to 40. She complains of general dizziness and so on. Skin lesions resemble second-degree burns. Here and there, erosive surface or epidermis layer. Nikolsky's symptom is positive. Again, let's revise those three common conditions. Number 1, Staphylococcus cadet skin syndrome, that will cause exfoliative dermatitis. We also have pemphigus vulgaris, and we have the third one. We say we have the toxic epidermal necrolysis. So, which of these condition here, since we've mentioned, you can see we have pemphigus vulgaris here, we have acute epidermal necrolysis that we mentioned. But they said this child took 2 pills of aspirin, which means that aspirin plus possible viral infection in this patient is what is causing this manifestation. And this is a case of toxic epidermal necrolysis just by the presence of this aspirin that they are telling us. You remember we talked about Stevens-Johnson syndrome. The difference between toxic epidermal necrolysis and Stevens-Johnson syndrome is simply the percentage of body area that is affected. If less than 10% of body area, surface area is affected, we go with Stevens-Johnson syndrome. If greater than 30% of the body surface area is affected in terms of Nikolsky's symptom, that is in practicality, we are talking about acute epidermal necrolysis or the toxic epidermal necrolysis. 5-year-old child had an attack of palpitation with nausea, dizziness, generalized fatigue, and so on. Tachycardia with heartbeat of 220. Ventricular complexes are deformed and widened. When we talk about ventricular complexes being deformed, we are talking about the origin of this tachycardia to be in the ventricles, and it's very dangerous. So how do you treat if lidocaine is used for ventricular tachycardia? Lidocaine is used for ventricular tachycardia. And that is ventricular tachycardia. Ventricles complexes are deformed. Alright, 4-month-old child, some lemon yellow squammy with fatty crust on the scalp. What is the most probable diagnosis? I just cramming this question. I don't know what this NACE is. This is NACE. I think I want to check it up. I couldn't even get anything associated from there. So this NACE, like they said, lumbar puncture was performed for a newborn suspected of having intracranial birth injury. Bloody cerebrospinal fluid was obtained. What hemorrhage occurred again? Bloody the cerebrospinal fluid is present in subarachnoid space, so it must have been subarachnoid hemorrhage. So we did do last 10 questions.